Ladies and gentlemen, you are welcome back to the online pregnancy school. We are talking about reproductive health, and we are going to continue our discussion on family planning. My guest is Dr. Benedict Afari, an obstetrician gynecologist. We have looked at family planning in general. In our future videos, we'll be taking the methods one after the other and go into more detail and also show you how they look like so that you have a good idea. And when you go to the hospital and you are talking about a particular method, you would have seen it on video before and heard about some of the things to do with that particular method. And the midwives and the other people will help you in choosing, as he told us, that they are trained. And so they take you through some questions before. Please, when you go and they're asking you questions, tell them the truth. Tell them everything that they need to know so that they will help you to choose the right method for yourself and your family. Doc, today we are going to look at some myths and misconceptions. You know, family planning is one of the areas that we have heard so many myths, but it is good to talk about them so that we can address them if need be. So what are some of the myths associated with some of these methods? Maybe you can take individual methods if you have individual myths related to each of them. For example, the IUD. I've heard so many myths about them. So if you can take them and take us through some of them and whether they are actually true, whether they can happen as people have heard. Somebody will say that there's no smoke without fire. So what are some of the myths that you have heard in your work?
Okay, so just as you said, let's take the IUD for example. I think about a year or two, it was out there that the IUD can cause cervical cancer. But we know that it doesn't cause cervical cancer. The cervical cancer is caused by HPV infection, that's the human papilloma virus. So you having an IUD in doesn't mean that you have cervical cancer. So that one is there. The one myth is that if you adopt any family planning method, you may not be able to give birth again, especially for the young people. So sometimes they will come to if maybe a young person, even an adult, let's say maybe 19, 20, you are not an adolescent. You are 20 years, not adolescent, but you haven't started your family, but you want to adopt a family planning method. They may tell you that, hey, once you've not been pregnant before, you've not gotten pregnant or given birth before, you don't have to do it because it may prevent you from getting pregnant for the rest of your life. But it's not true. We all know that the family planning method, no matter the one that you use, the hormonal, the pill, the injectable, IUD, implant, if you remove it or you discontinue the use, you will get pregnant. So it doesn't matter whether you are young or you are old. Once you can get pregnant, it's okay for you. Then some people may also say that when you adopt some of the family planning method, maybe you get some chronic illness. So because of that, they will not let you take it. But the family planning method doesn't give you any chronic illness. You know, some people may have some conditions already. Maybe somebody has hypertension. It has not shown up. So they go and adopt, let's say, one of the hormonal method, like an injectable on an implant, and they realize that their BPs have gone up, and they will blame it on the family planning method. But for all you know, they have the risk. It's just that it is now that it's being shown. Then we talk about people gaining weight. There is an element of some small weight gain with some of the method, especially let's say injectable and the implant. But there have been people that have used this same method for years, and when you see them, they are lenge. They have not put on weight. You know, some people already have some genetic disposition for putting on weight. And sometimes, as they say, it is because now you have a lot of peace of mind. You are not thinking that you can get pregnant. So you are having sex frequently and adequately. So now The
Right.
peace of mind is making you put on weight. So it's not necessarily the method that is making you put on weight.
Wow.
Then sometimes some people may say that when you adopt a certain method, let's say, especially the hormonal method that they have a lot of problem about, that it will change your menses, it will not let you menstruate and all that. But all those things are not true. You know, the
But
body,
I have
uh-huh.
heard people who have said that when they started the family plan, they didn't see their periods for about 3 months. Or sometimes they see their periods, but they are irregular or they are scanty. So are they not true?
Yes, so the family planning in general, especially the hormonal methods, the ones that have estrogen and progesterone, affect the menses. So you can have different menstrual changes. So let me go into it. And we actually tell the women, it's just that, women are very interesting people.
Oh.
Anything concerning their menses, they are so much concerned about it. So, for example, you may have some changes with the menstrual cycle. So, one change could be that your menses can delay, and that one is perfectly normal. Sometimes it will delay. That is one. There are times that the flow can reduce. That is also normal. Sometimes the flow can be increased. That is also normal. But we have some limits. For example, if you're on a method and your menses is coming more than a week, it is not normal.
Okay.
Or sometimes we use 2 weeks as an interval. Or let's say you are on a method for a whole year, your menses has not come. That one, we are also going to be concerned about it. But we tell them that even though there may be some changes, some slight changes with your menses, once you stop the method, it will resume or it will come back to normal. We also know that sometimes some people, there's a bit of a delay in the resumption of the menses. That is also perfectly normal for them. As individual, our bodies respond differently. So that is also one myth that, for example, somebody will go and take, let's an injectable. The menses may not come. Another person will take an injectable. The menses will come every month. But somebody will tell that, oh, when I took the injectable, my menses did not come. So if you go and take it, it will not come. So that person, because of that, they will not go and take it. You understand? So that's also because we have individual differences and our bodies will respond differently to the methods. So for the non-hormonal, you don't have any issues. But with the hormonal method, you may have some slight changes in the menstrual cycle, either in terms of the duration or the cycle length. But it is not abnormal, it is not cancer, and it is not something that is going to affect you in future. Once you discontinue the methods, most of these menstrual changes, I'll call them changes, or adverse effects will come back to normal. So they shouldn't be afraid. And we always tell them that you may see some slight changes in your cycle, but if it is bothersome for you, you come back. We'll explain it further, or we can do something about it.
Okay. Ladies and gentlemen, if you are watching us today, we are talking about family planning, some of the myths, and we also look at misconceptions that people have heard and said. Maybe some people have experienced some things and they have shared with their friends. I'm talking to Dr. Benedict Afari, an obstetrician gynecologist. If you haven't done that yet, kindly go ahead and hit the subscribe button. Remember to turn on the notification bell so that you will not miss any of the sessions we bring your way. We'll continue with our discussion on the myths and misconceptions about family planning. Ladies and gentlemen, so we are continuing with our interesting discussion on family planning, some of the myths and misconceptions. Doc, there are many women who, as you said, are really concerned about their menses. So if my menses change, I surely would be concerned.
Yeah.
And you're saying that these are things that we shouldn't worry so much about. And one thing that I like about what you said is that if you go home and there's anything that is a worry to you, please go back to the hospital. It doesn't matter if you went yesterday. If you go home and today you find that there's something that is bothering you, just go back to the hospital. It is better to have a check than to stay at home and say, let me wait for about a week or two and see what will happen. And if your period is not coming and you are not pregnant for one whole year, please, you don't have to stay at home. Go to the hospital. I am very, very sure that they would check it out for you and help you so that you know you are well. And then you have some peace of mind for yourself. Doc, I have heard that the IUD can travel to the heart.
Okay, so I'm sure when we start going into details about the IUD, you see it. So the IUD is like a plastic with this very small coil copper around it. So, we put it in the womb. So if there is no opening on your womb, then that means the IUD cannot travel anywhere. Unless there is a hole on your womb or there's an opening on your womb somewhere, then the IUD can leave the womb and go somewhere. And we know the IUD is not having legs to walk or wings to fly. So once we place it in there, there's no way it will travel to the heart.
Okay,
Yeah.
we hear you. You are an obstetrician gynecologist. You have been seeing
Yes.
women and you have been doing this. So if you tell us that it will never happen, then we take it that it
Exactly.
doesn't happen. But when you look at the anatomy of the human body, you look
Yes.
at the woman, you look at the womb and how it is placed and where the heart is and the kind of compartments that each of them is in, it is really to be a miracle to have
Yeah.
the IUD travel from
Travel
the
to the
womb
heart.
into the heart. That would be a
Yeah.
miracle. Yeah, but we
Yeah.
don't want that miracle to happen. We want good
Of
miracles
course.
to
Of
happen.
course.
Yes, we don't want that to happen. Yes,
Yeah.
so what are some of I know we'll be talking about individual methods, but generally, what are some of the things that people should be aware of if they decide that they are going to ask for one of these methods? Generally, what should they be thinking about? What should they be concerned, if anything, about that? Today I'm getting up, I'm going to the hospital. Maybe I have a child. I just had a baby 3 months ago, 6 months ago, and I don't want to be pregnant in the next 2 months. And it happens. Some people go on maternity leave, they go back to work, and they are pregnant again. So I don't want that to happen. What should I be concerned? What should I think about as I get up and I'm going to the hospital to ask for a method?
Okay. So in line with the misconceptions and some of the adverse effects that can happen, we want people to know that there's something we call medical eligibility criteria.
Okay.
So what it means that it's not everybody that can take any method at all. So that is why it is important that as a client, you go to the right place. Because you could just say that, oh, somebody has done this an injectable, so you want to go and take an injectable. But if we take your history well, we examine you and we ask you about some questions, we may realize that, okay, this particular method will not fit your profile in terms of your medical profile. And that also helps us be able to avoid a lot of the problems and even also to reduce the failure rates and even the complications that can also arise. So we need to make sure that we are applying the medical eligibility criteria for every case that comes. That's why you need to go to the right place.
Okay.
So that we know that, okay, for this person, we don't need to give you this method. Let me just give an example.
Sure.
Most people complain that the IUD, when you have it, you have an infection. But what it means that it's not the IUD that gives you the infection. But the fact of the matter is that because it's an invasive something, if you are a woman that you tend to get an infection a lot, it might not be a good method for you.
Okay.
And we also say that the IUD or most of the contraceptive methods, apart from the barrier methods, they don't prevent sexually transmitted infection or infections in general. So we have to make that one clear. If not, you may go for the IUD, for example, and you'll be having repeated or persistent infection, and you blame it on the method. But it's not the IUD that is causing the infection, but because you are acquiring infection yourself. So once you acquire infection, IUD will not be a good method for you. And that is why when we are even giving you the method, we will counsel you. And there's a technique. And we have to make sure that there is aseptic technique before we actually do that, so that we prevent all this infection. Because if not, we may have to remove it. Because you tend to get a lot of infection. And you see, once it is removed, then there's a sexual activity and they will get pregnant. And now the client will say that it is the IUD did not work and now she's pregnant. But we all know that any of the contraceptive methods, if you stop using it, if there's discontinuation, you will get pregnant. So, and for some reason, we've realized that maybe it's just an observation, but those who actually adopt the IUD, the moment they remove it, they are pregnant.
Oh, wow.
So you may now be blaming that, oh, the IUD didn't work out. But it is no more there. I mean, it is not there again. So, so these are some of the things. So for you should know, because if you have certain medical condition, like you are prone to developing clots. If you are prone to developing clots, some of the methods are not good for you.
Okay.
If you have varicose veins, some of the methods are not good for you. If you have some form of cancer, ovarian cancer, all these reproductive tract cancer, some of the methods are not good for you. So we need to be able to counsel the client for them to know the methods that are good for them. Then you will get the benefits. So, and you see, family planning is not just about preventing the pregnancy. We actually have what we call non-contraceptive benefits of family planning. Yes, that is also very interesting. When we take the methods one by one, we'll talk about the contraceptive benefits of each of them and then non-contraceptive, because you realize that a lot of people don't know about that. So they may not even adopt the method. But if you know that, hey, this method can actually prevent certain cancers, it can prevent certain infections, it can prevent certain diseases, then they will say, okay, let me try this one and see.
Wow.
And they can tell other people about it. Yes.
Doc, you're whetting our appetite for the sessions on the individual contraceptive methods. That is very good. For the condom, are there any misconceptions or myths that you have heard about?
Yes,
either
so
the male or the female.
The female. For the female condom, even the women don't want it. And the reason is that, I mean, we must admit it's a bit cumbersome to use. And if you don't really know how to use it, it may affect the interaction. You understand? Then we also tell the client that you don't have to use a male and a female condom at the same time.
Oh, okay.
You don't have to use a male and a female condom at the same time. You use only one at a time. So you can use a female condom at a time and a male condom at a time. And you see, compliance is important.
Double protection.
Yes,
maybe
but yes.
Want so double protection. So you do it. So that we have double protection.
It will actually spoil everything, because there's going to be a lot of friction.
Yeah.
And you see, condoms can break. We have to know that condom can break. It can slip. And it is all because we are not using it well. So it's not everybody that can. There's a way you have to use the barrier method. If you don't know the right way to use it, even some people, they taking it from the plastic container, they can cause some bruises or some breaks, because some people, they don't even know how to open it. So if you don't open it well, it's a problem. And you see, if for example, we are coming to use a condom and your hands are not clean, that means you are going to introduce an infection right there. And if you don't know how to wear it, it will remove, it will slip off, it can break. So these are things are there. So you should know how to use it. You should just think that, oh, I forgot, everybody can use it, everybody can use it. No, 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 no. Yes. So, and both the man and the woman, they should all know how to use it. And it's even quite romantic if a woman is helping the man to put on the condom, you know.
I see. That is very interesting. I'm sure a lot of people will start trying. Ladies and gentlemen, we are talking about family planning. We have looked at some of the methods in general. We'll be looking at them individually as we go along. But now we are discussing some of the myths and misconceptions. And if you want to have a family planning method, some of the things you must know. And Doctor has taken us through the eligibility criteria, which is something that is done before you are supported to select or choose a method. So you can't just go to the hospital and say that I've come, my friend used this method, so I also want that one. It is not like that. And that is what Doctor has told us. Doc, we have had a very interesting discussion. Ladies and gentlemen, if you haven't done that, you see, we are going to talk about each of these into detail in our subsequent videos. And you wouldn't want to miss that. So please go ahead and hit the subscribe button and turn on the notification bell so you don't miss any of the sessions we bring your way. I'm talking to Dr. Benedict Afari, an obstetrician gynecologist, and I am Dr. Linda Vanutu. Doc, are there any other misconceptions that you have heard, like the IUD? They say it can fall off.
Yes.
Is it possible?
Yes, so the IUD, there can be displacement.
Okay.
Displacement is important. You know, the way the womb is, there's a way it has to be put there. So if it is not put there well, there will be displacement. And if there is displacement, you can get pregnant.
The displacement, do you mean it coming out or moving to another part of the womb?
Good. So the displacement in the sense that it can shift.
Okay.
So you realize that it can shift to one side, and the stubborn sperm can come and pass through another side and go. Yeah, so it can displace. And it can actually fall off. If it is not put in well, it can fall off. Then sometimes with the string, you know, there's a string attached to it.
Yeah.
Sometimes the string can remove. And it becomes difficult to take the thing out when it's time is due. And sometimes it can get stuck inside the womb. Yes, so there can be displacement. It can fall off. It can get stuck. Yes, so these are, and it's all about the technique. Once it is done well by a professional, you can avoid some of these problems. But if it's not done by a professional, then you can have some of these complications.
Okay, yeah, good to know. So for those who are thinking about the IUD, these are some of the things, but we'll be going into detail with each of them and possibly see how these are done, so that you have a good idea of what is displacement and what is it falling off, the cord breaking and all that. Doc, we want to say a very, very big thank you to you. It has been a pleasure talking about family planning, some of the methods and some of the myths and misconceptions that we have. Your parting words.
Okay, so family planning, it's for everybody. So it's for the man and it's for the woman and even adolescents. And we shouldn't shy away. Then there are actually economic benefits to family planning.
Wow.
I mean, countries that have taken family planning seriously, it has really helped them, because it has helped to control the population, even though some people don't want to accept that, but it's important. And no, family planning has economic value. It has contraceptive benefits. It helps couples to achieve the number of children that they want, the timing, and even also helps couples to achieve pregnancy. So it's not only about preventing pregnancy, we can help you to achieve pregnancy. And there's another component of family planning, which is even sex education and management of other reproductive tract problems. So it's a comprehensive service that when you go to any of the reproductive health units, we can avail these services to you and you enjoy your family planning method.
Thank you so much. That is what we want to do. We want people to have a life that is enjoyable, but then it should be done within the right environment. Yeah. So Dr. Benita Fari has told us a lot, and there's a lot to learn. As he has said, the concluding remarks tell us that there's still a lot to learn about family planning. You see, a lot of people, I believe, when they hear of family planning, they just look at the commodities, condom, the injectable pill, that it is not just about that. It's about all that he has said, and even the concluding remarks about the other benefits that you would get as an individual, as a family, as a nation, and as a whole world. So subsequently, we'll be discussing all this into more detail. Doc, once again, thank you so much for your time. It has been a pleasure talking to you and you telling us a lot, opening our eyes to some of the things that probably people have not thought about when they think about family planning. Ladies and gentlemen, this has been the Online Pregnancy School. I hope you have enjoyed today's session. Please go back to our previous videos. You know, Doctor was talking about the progesterone and estrogen and all that. We have had sessions on menstruation. This is something that a lot of people find kind of difficult to understand, how menstruation takes place, what it is, and how the hormones work out so that you have your period or you don't have your period, and a whole lot of other things. It's important to go back to our previous sessions. We have over 100 videos that we have put together on different aspects of reproductive health, and we'll continue discussing as we go along. So please go back to our previous videos and watch them. And if you haven't done that, just go ahead and hit the subscribe button. Remember, please turn on the notification bell and invite friends and family. Nobody should die because the person was trying to get pregnant or got pregnant or even went to deliver. Most of these deaths are preventable. Until we come your way again with another interesting topic, because we'll be continuing with our discussion on family planning, it is bye from us. Bye for now.